this video, this end-stage kidney patient was saved from the machine almost overnight. His kidney function jumped from 6.7 to 18.2. That's a 170% improvement in a stage 6 patient. And the most incredible part, it's how he did it. Catherine here, I'm a doctor of natural medicine. A lot of CKD patients are doing their very best to avoid the Big D machine. They follow a diet, they take the supplements they need, they take the prescribed medications. They will be right to expect an improvement, but most of them will just end up on the machine anyway. Why? For most patients, a complication of CKD is why the machine becomes unavoidable. But what exactly is a complication of CKD, you ask? Think of it like this. The lights go out, so you stumble through the dark trying to find the main breaker, only to stub your toe along the way. Ouch! And now, you have a much bigger problem to solve, right? But you see, suffering from swelling or chronic gut dysbiosis is a million times worse than a stubbed toe, because there are 5 complications of CKD that can make all your efforts of avoiding the machine vain. And to make things worse, most patients are not receiving the treatment they need for them. Today, that changes. I will tell you exactly how to identify and treat the 5 most dangerous complications of CKD. Don't miss my number 1 in particular, because when this man received a supplement for that specific complication, all of a sudden, the machine was no longer on the table. Before that, let's talk about our number 5 for today. This is an incredibly common yet absolutely underrated complication that more than 7 out of 10 CKD patients are facing, but almost no one is receiving adequate treatment for it. Guys, please let that sink in for a moment. This kidney killer complication, you are more likely to have it than not to have it. I'm talking about high PTH or hyperparathyroidism. And here's the thing, this complication is scary, but you don't have to lose your bones or your kidneys to it. High PTH is treatable. Here's how. High PTH is a condition that happens when there's an imbalance between your vitamin D levels, usually too low, and your phosphorus levels, often too high. In order to try to balance these levels, the body will use the parathyroid hormone to borrow some calcium from your bones. This is a bit like when it's the end of the month, you need to pay the bills and you borrow some money from your kids' university fund. It's no big deal if it happens once or twice, but if it becomes a habit, it can cause bone pain, fractures, vascular calcification, weakness, brain fog, even depression. I mean, I'm talking about having high PTH, not about borrowing from your kids' university fund. That's perfectly fine in this economy. Anyway, how can you tell if high PTH is damaging your kidneys? Well, as you can see on screen, there are no early symptoms. So don't wait for a bone to break before doing something about it. There is a simple routine test that every CKD patient should be doing starting from stage 3. It's called intact PTH test. If this value is above 70, make sure your doctor investigates the cause of the issue, alright? Don't settle for a wait-and-see approach, because very, very often, this serious complication of CKD can be caused by a simple vitamin D deficiency. So, here's what you want to do in detail. First, make sure your vitamin D is being monitored and start a supplement if your level of vitamin D is below 30. Then make sure your phosphorus is under control. More about this in a moment. And consider including a renal multivitamin. Even better, take Rena Best, the best renal multivitamin. Look, renal multivitamins can help here because they have vitamin D. Any half-decent renal multivitamin should have vitamin D. But what makes Rena Best the best is the fact that I designed it with my kidney patients in mind. There's no funny stuff in Rena Best, no titanium dioxide, no magnesium stearate like you find in so many supplements, and I've only used the best vitamin forms for Rena Best. You won't find any cheap, barely safe vitamins like cyanocobalamin. This form of vitamin B12, the excess gets turned into literal cyanide inside your body. But it's cheaper, so all the renal multivitamins on the market use it. Rena Best is the exception. We only use methylcobalamin, the natural, safe form of vitamin B12. We are the only ones doing that. You can double check. Find Rena Best on renabiotech.co or check the link down in the description. Okay, let's move on. Let's talk about the next scary complication you should prevent. Number 4. This is a complication that's common in people taking Farxiga or other SGLT2 inhibitors in people with diabetes and in older adults. But that can be prevented very easily. I'm talking about urinary tract infections or UTIs in short. Now, UTIs are a serious and seriously underestimated complication of CKD. According to statistics, almost 1 out of 3 CKD patients suffer from a urinary tract infection. But those that should be particularly concerned are patients suffering from diabetes. You see, diabetes puts you at 10 times higher risk for UTIs than the general population. Women, older adults, transplant receivers, people with enlarged prostate, and those taking SGLT2 inhibitors are also at higher risk. And you see, many patients are in more than one of these groups, alright? Yeah, most CKD patients are basically walking targets for UTIs. And while UTIs are very common, we should absolutely stop underestimating them. You see, UTIs are not just painful, they can wreak havoc in your kidneys. If left untreated, bacteria can move from the bladder up to the renal tissue. This is called pyelonephritis, and it can easily and permanently bump you up by one CKD stage. UTIs are also pretty scary because even if they don't get to your kidneys, a UTI might still lower your GFR and increase your proteinuria levels. Don't take the risk. But how can you tell if you have a UTI? Well, the earliest symptoms are burning or pain during urination, frequent urge to urinate, and discomfort in the lower abdomen. In some cases, blood in the urine, fever, and back pain can also be present, but those aren't early symptoms. That's when you go to the hospital. And of course, you will need to get some urinalysis done to confirm there's actually a UTI. But now the question is, how do you treat a UTI? Well, the treatment is medically prescribed. It's an antibiotic course. And yeah, this could put even more strain on the kidneys. So if you have recurring UTIs, also consider a natural approach to this problem. First of all, get started on a high-quality renal probiotic like my Renabiotic from Renabiotech. Guys, I personally recommend probiotics for the prevention of UTIs for almost a decade now because this stuff works. Yeah, it turns out that a good renal probiotic doesn't just slow down kidney disease progression. It may actually prevent a UTI by increasing the amount of good bacteria in your gut, which will in turn decrease the bad bacteria going around. Second, something I would absolutely consider here is the use of cranberry extract. So here's the thing, the healthcare system doesn't really believe in UTI prevention, and that's a shame because when you have to wait for things to get worse before getting treatment, well, it can be painful. But as a naturopath, I know pretty well that an ounce of prevention is worth a pound of cure. So if you had UTIs in the past, consider cranberry extract. This stuff is so well researched, we even have a standard dosage to recommend. It's on screen right now. So if you are going to take a cranberry supplement, make sure they are certifying at least this amount of proanthocyanidins on the label. And don't get me wrong, while this natural treatment does not replace antibiotics, a combination of probiotics and cranberry extract is powerful against UTIs. It could literally make them a thing of the past. And frankly, it's very important to have a treatment that makes antibiotics less needed. Because you see, when it comes to treating CKD, there's a pill for everything. Blood pressure, here's a pill. High blood sugar, another pill. Cholesterol, a pill. Anxiety because of all the pills, here's your pill. But what happens when your body can't face this huge pill burden anymore and finally gives up? Well, it's called gut dysbiosis. And it's not pretty, but it can be fixed. This is why gut dysbiosis is our number 3 for today. And here's the thing, I consider gut dysbiosis the single most underestimated complication of CKD. Why? Because your doctor isn't just ignoring your gut health. Their standard protocol is actively destroying it. Let me explain. We have mountains of published clinical data proving how standard CKD prescriptions combined with outdated dietary advice literally mutate the good bacteria in your gut into kidney-killing pathogens. And science is very clear on this. An altered gut-kidney axis is a fast track to the big D machine. And it's not just that. Your heart, your arteries, your brain, your bones, these bacteria really take no prisoners. It's true. Leave this untreated, watch your GFR dive worse than a Brazilian footballer in the penalty box. So question, how do we prevent our gut from turning into a kidney toxin factory possibly before your doctor starts casually mentioning the machine? First of all, you need to understand this complication in order to fight it. Take a look at my infographic. If you notice any of these symptoms, take action. Constipation, bloating, excessive gas or diarrhea, especially if you are in one of the groups that are at risk for gut dysbiosis. People suffering from CKD, from diabetes, from obesity, people following a low potassium diet, and also those taking any of the medications you can see here. Yeah, that's a lot of people. So, what to do to stop this complication? First of all, rebuild the microbiome. Consider a probiotic supplement. Many studies are linking renal probiotics to better kidney function, and that's why you want a high-quality probiotic. Guys, there is only one brand I can confidently recommend. It's my very own Renabiotic from Rena Biotech. Renabiotic is different from the generic probiotics you find on the internet. Generic probiotics are loaded with the wrong bacterial strains, fermentable fibers, and cheap ingredients that trigger violent bloating, gas, and stomach cramps. Frankly, they have no respect for people with gut health issues. That is exactly why I engineered Renabiotic. We stripped out all the FODMAPs and built a formula using only proven, ultra-safe ingredients that actually heal your microbiome. Renabiotic is the very first renal probiotic truly designed for patients with compromised gut health. And that's why all my patients love it. And of course, the other very important thing you need to do in order to protect your precious gut health is eating more fiber. This is where a lot of CKD patients are following outdated recommendations, because when I say fiber, I mean fruits, whole grains, and leafy greens. But now you might say, Catherine, we can't eat that stuff. Don't you know those foods have potassium? Okay, let's talk about it. This is our number 2 for today. This is a complication that every single CKD patient is worried about, but that only affects 10% to 16% of CKD patients. I'm talking about hyperkalemia or too high serum potassium. Now, having too high serum potassium is also the only entry on today's list that will not directly damage your kidneys. Actually, we have large studies proving that eating more potassium actively protects the kidneys. It's true, guys. And here's the thing. This study is not saying that eating foods that naturally contain potassium protects the kidneys. It's saying potassium itself protects the kidneys. Read the study on screen if you don't believe me. Actually, I want to show you another study that says that, and I quote, "Following a low potassium diet may be deleterious for patients with CKD." So breaking news, guys, science proves once again that the more you limit healthy fruits and vegetables like avocados, leafy greens, oranges, and bananas, the sooner you end up on the machine. Let that sink in for a moment, because most CKD patients are just as scared of eating bananas as they are of their hospital bills. The result, each year, more and more patients end up on dialysis. Yeah, the dialysis industry has never been this profitable. They are forecasting an $181.16 billion market size by 2032. Incredible! So, you have two options here. First option, put your retirement funds in a dialysis company so at least you will be able to afford the machine when time comes. Second option, keep learning about the disease that's getting you there, like you are doing right now, so maybe you can stop it. So how do you turn the tide on potassium before it gets you to the machine? First of all, make sure you are only following a low potassium diet if your doctor prescribed it, alright? And no, the internet is not your real doctor. I'm talking about a real nephrologist, the kind who has a kidney model on their desk and actually reads your labs. Don't follow a diet that destroys your kidneys just because some internet video scared you. Remember, only about 10 to 16% of CKD patients really have high potassium. Second, if you actually have high potassium, make sure your doctor targets the real cause of the issue. Science says that if your potassium is too high, ACE inhibitors and ARBs are usually to blame, not your diet. Your lisinopril, your Zestril, your Vasotec, these medications are causing the potassium problem. Something else that could be causing high serum potassium is having uncontrolled diabetes, eating animal-based foods, or suffering from constipation. Never think that avoiding bananas and spinach can help if any of this is still present. Because the truth is, a lot of CKD patients are doing their very best to stay free from the machine, but most of them will fail, not because this disease is impossible to treat, but because they are following the wrong advice. High potassium is treatable when you address the real cause, just like the next complication. Number 1, like I mentioned in the beginning of the video, a man was saved from dialysis with a single daily pill. His kidney function jumped from 6.7 to 18.2, which is a hugely impressive improvement. So, what medical miracle saved this man from a life tied to a machine? A phosphate binder. Now, phosphate is a mineral that's a bit the opposite of potassium. A lot of people underestimate it, but it's a real kidney killer. If you have symptoms like muscle cramps, bone and joint pain, itchy skin, or a rash, make sure your serum phosphorus is actually getting monitored. Consider that if you are in the advanced stages of CKD, your phosphorus is more likely to be abnormally high than normal. Now guys, a phosphate binder can be a lifesaver here, but like I was saying, it can cause other problems like gut dysbiosis. That's why a binder should never be the first line treatment for a phosphorus issue. Instead, start with a renal diet. If you have CKD, you need to avoid anything with animal base or added phosphorus in it, alright? So, no meat, no fish, no eggs, no dairy, and no packaged foods that include phosphates in the list of ingredients. They are labeled with phos on the ingredient list. Seriously, if you see phos, run! Run like you just saw a grizzly bear in the woods. This is what any CKD patient should do. I mean, not the grizzly part, the phos part. On the other hand, plant-based foods that are sometimes considered high phosphorus like legumes, nuts, and whole grains should never be limited based only on phosphorus. Why? Because we know very well that the phosphorus in plant-based food is not absorbed by the body in a significant amount. So be smart. If the label says phos, don't put it in the cart. And if you want more kidney saving tips, my video up here is for you, and this is all for today. Thank you for watching. God bless you all. Bye!